When we use the term genetic testing, that can mean a lot of different things in the fertility clinic. For whatever reason, in the past week, I've had this conversation with my patients multiple times, and it seems that there's a lot of confusion about two very distinct genetic tests that are offered in the fertility clinic setting: carrier screening and something called PGT, or pre-implantation genetic testing. Carrier testing is testing that is done on a couple or an individual before they create embryos, ideally. And PGT, or pre-implantation genetic testing, is a test that is run on the actual embryos themselves. Carrier screening is a thing because all of us carry mutations. And if you go back to high school biology, a lot of genetic disorders that exist require 2 copies of your genes to be mutated. A lot of our genes come in pairs, just like our chromosomes come in pairs. And so if you happen to be a carrier for a gene mutation, which most people are a carrier for something, nowadays the panels that we're using are like 400 something diseases long, then all we care about is that your partner doesn't carry the same thing. Or if you're using donor sperm, you're gonna make sure you're choosing a donor that's negative for the thing that you carry, so you're avoiding that situation altogether. When we collect blood work from you and or your partner to do this testing, there's a lot of DNA that can be utilized to run all of these tests and to look for all of these different types of mutations. PGT testing on an embryo, however, is working with very, very small amounts of DNA. You have an embryo with 100 to 200 cells. There's cells that cluster together that will one day become the fetus, and cells that line the outer part of the embryo that will one day become the placenta. But you're only going to take away maybe 4 to 9 of those cells at the most and send them off for genetic testing. And what we typically look at, the standard version of PGT, is counting the number of chromosomes, the amount of DNA, which can be missing or duplicated in anyone's embryos. We all have the ability to make genetically imbalanced or abnormal embryos, and that's what PGT is really looking for. Now, patients will often say, well, why do I have to do the carrier screening? Why can't you just run that test on the embryos? And the answer is, we're working with too little DNA to be able to run that many tests and to be able to look for all of those mutations. So basically, we're doing a risk assessment, and if we find out that you are an at-risk couple where you could pass down a genetic mutation in a way that could actually affect your child, then you have 2 options. You could say, I'm going to do nothing, but at least I'm going into my pregnancy informed, and I'm going to know what to look for on the genetic testing like CVS or amniocentesis in pregnancy. Or you can say, I don't want to be in that situation, and I want to prevent this from happening in the first place. So when we do IVF, now we know what to look for in addition to counting the number of chromosomes. So the way I handle this is when patients come in, I educate them. I recommend, doing the carrier screening. I always say it's a thing that makes sense to do preconception. Why wait till you're already pregnant? Because then, there isn't really much you can do to prevent. It's more about waiting for the testing, and that's very anxiety provoking to a lot of people. What I often will see is sometimes when patients have done IVF somewhere else and they're talking about transferring their embryos or their journey, they maybe just at the beginning kind of said, I'm waiving the genetic carrier screening without really truly understanding the purpose behind it, thinking, hey, I'm going to test the embryos anyway. And on occasion, I'd say like 2 to 4% of couples will match up for something. Or sometimes the female partner will be a carrier of an X-linked disorder, which will affect 50% of her sons. And now they have these embryos that they didn't do that specialized screening for. Maybe they screened them to see if they were euploid, but now they have a dilemma. Do they roll the dice and just transfer one of those embryos and then wait to do their CVS testing at the end of the first trimester? Or do they now make the decision of whether to thaw, rebiopsy, and then refreeze the embryos, which is something we do, but it's not the most ideal thing, right? It's an additional exposure, and that's a whole nother reel for another day. But I always say, if you're gonna do things, I'm type A, I like to do it right the first time. And so my recommendation is everyone should consider preconception carrier screening so that you can be better informed and prepared as we move towards creating embryos, making sure you know what to look for in the embryos and which tests to do, and that you don't miss an opportunity to have a better outcome.